First, we need to know that COVID-19 is a virus, right? It's a new strain of a range of viruses called coronaviruses that we already know. And COVID-19 has as an illness representation a respiratory infection, right? And so it appears with the following symptoms. First, it's the fever, right? 38 degrees, right? Or more. Also, we have as a symptom coughs, sore throat as well. Less frequently, there are some people who have shown diarrheas and some vomiting, right? So basically, these are the symptoms of COVID-19, and these are the mild symptoms. So what we should know is that the COVID-19 has a wide range of representation, clinical representation or illness representation. Okay, so it goes from asymptomatics, so people carrying the COVID-19 but not showing symptoms, and we have mild symptoms, and it's the symptom that I just mentioned, and we have severe symptoms, and it's basically it's shortness of breath, chest pain, and impaired consciousness. So these are basically the severe symptoms that we can observe. With regard to the difference between COVID-19 disease and seasonal flu, in general, are caused by influenza viruses, right? So before answering to difference between these two viruses, COVID-19 and influenza virus, I would like to speak about how these two viruses could be similar. So first thing is that COVID-19 and influenza viruses have a similar disease presentation, right? So that is, they both cause respiratory disease, and this respiratory disease have a wide range of illness from, as I said, asymptomatics to mild symptom to severe illness. So both of these two viruses have this representation. Both of these viruses are transmitted by contact, respiratory droplets, right? So which means that the same public health measures are taken for both, which are hygiene, hand hygiene, and respiratory hygiene, etc. So these are the common point between these two viruses. Now, the difference between these two viruses is that firstly, many people globally have built up an immunity to seasonal flu, to influenza viruses, because it is somehow an old virus. We already know about this virus. When COVID-19 is a new strain for our bodies, and that means that more people are susceptible to infection by the COVID-19 virus than the influenza. The symptoms of the seasonal flu appear sooner than the symptoms of COVID-19, right? And that means that the flu can spread faster than COVID-19. The flu is common in children. When COVID-19, or let's say the incidence of COVID-19 to date, seems lower in children. So this range of symptoms from asymptomatics to mild symptom to severe illness are similar, but it seems like the fraction of the severe illness, the severe symptoms, appear to be higher for COVID-19 than influenza. Many people are asking this question of how can I reduce the transmission, the human-to-human transmission. The best way to know how we can effectively reduce the human-to-human transmission is that to understand how COVID-19 spread, right? How is the COVID-19 spread? And for that, there are two main points. Right? The virus is transmitted, the COVID-19 virus is transmitted through respiratory droplets, right? And these respiratory droplets are generated by coughs, speaks, sneezes, and we can find it also in the mucus of the eye. So that's why we can hear or read somewhere that tears can be a transmission. So the logic behind this information is that the mucus contains the COVID-19 virus, right? That's why we can hear about this way of transmission, right? The second point about transmission is that the COVID-19 can survive on surfaces, right? Which means that individuals can also be infected from touching these surfaces and then their face, right? Mouth, nose, and eyes, because we have mucus in eyes, right? So now we can understand through what I've just mentioned that the hygiene is the most important measure of prevention. We can't face a fire with our eyes closed. The most we know about infected people, the best it is for the population. So testing is a good way to prevent and to treat COVID-19 and to contain it. There are a number of therapeutics currently in clinical trials, especially in China, okay, and also in other countries. And there are more than 20 vaccines in development around the world for COVID-19, right? However, there is no licensed vaccines or therapeutics against COVID-19. Not yet. We may see around the world countries using some therapeutics, right? So it is a choice, it is a decision. Today we can't say and judge that it doesn't work or it works, because for that we need studies, we need numbers, and we need time. What we can say is that there is no licensed and proven vaccines and therapeutics against this COVID-19.